Have you ever seen alternative treatments with repurposed drugs, lifestyle and diet changes be able to shrink a single small metastatic tumor? I was diagnosed with endometrial cancer 8 months ago, and after the hysterectomy, chose the alternative route to heal instead of chemo and radiation. There was one drop metastasis that surgeon missed in the pelvic area, and it has gotten a little larger, but has not spread elsewhere. Thank you. So, Linda, I don't know if you want to add to that question.
Yeah, I made all the changes, the typical things: diet, lifestyle, reduce stress, forgiveness, mental work, detox. And now I'm at an integrative center. I'm actually on an IV right now, and they're having me start the repurposed drugs protocols. So that's kind of where I'm at. My big question is, what are your thoughts on repurposed drugs for endometrial in a situation like this? And then my second question on a different thing was about IPT and surgery, and your thoughts on those in my particular situation.
Well, what do they have you on for repurposed drugs?
Well, I just started mebendazole,
Okay.
metformin,
Okay.
LDN,
Okay.
and ivermectin.
Okay.
Then they want to slowly add in atorvastatin
Right.
and doxycycline, celecoxib.
Right. Nope.
And I have gut issues, so.
Right. No, I wouldn't do the last two, and that must be the Care Oncology program, because that's what they use. And what we're doing is we're doing fenbendazole 3 to 4 days a week in kefir, believe it or not, with a little bit of erythritol and maybe some stevia and some almond extract, because the benzaldehyde in almonds is also anti-cancer. So we do that like 3 times a week or 4 times a week, and then mebendazole the other days a week, because when you do it that way, the mechanism's interesting. The fenbendazole will actually downregulate the receptors on the tumor cells called GLUT receptors. These are glucose receptors. And fenbendazole downregulates those, and it blocks glutamine. Glutamine feeds tumors. Okay, this is why I don't give glutathione. I give NAC instead, because it pulls off the glutamine and raises your endogenous glutathione, but not in a situation where you're going to have too much glutamine. On the contrary, it pulls it away. So everything they're talking about there is pretty good, except I don't like the doxy. It completely destroys the GI tract. I don't think this is wise at all. I think they should be using either, well, there's several different things. Kefir is one, kimchi is one, a lot of these fermented things, and also kefir itself help to reestablish that gastrointestinal bacteria. Metformin does too, by the way. The diabetic drug metformin helps reestablish good bacteria in the GI tract. And I wouldn't do the anti-prostaglandin drug on you. I would prefer a natural one. I think it would just be much better. And then you can do fish oil to downregulate those. You don't need to. And also Boswellia serrata. They should have you on Boswellia serrata. I would definitely encourage Boswellia serrata instead of any of these other prostaglandin inhibitors that can affect the heart.
So you're recommending not to do atorvastatin and celecoxib?
Celecoxib,
and
no. Atorvastatin is okay, or simvastatin. They're both okay. Those are all right, but you do have to take a CoQ10 once or twice a week, because it can weaken your heart. So that's one of the reasons for that one. I mean, it's not a bad protocol. It does help, but there's just a lot more out there with the fenbendazole and the other things. And also for endometrial and ovarian, we really recommend pawpaw and vascustatin, because they have a terrific inhibitory effect on that particular area. And of course, my patients get a topical oil that we've been able to reverse tumors with also. And that's kind of wild. That blew my mind. I had a tumor from a lady who had breast cancer, and she had a tumor behind her eye. and they were going to use proton therapy, but she would have been blinded. And it was pretty big. The pictures from the ophthalmologist were huge. And we used the oil around her eye, and it disappeared in 3 months.
Is there a way to get that oil?
Not yet, not yet. It's limited right now to my patients and my patent lawyer so that we can actually get it out as a product to help support the cancer research that the foundation's doing. Because we're working on, one is a vaccine therapy that will actually raise your immune system. There's nothing to do with these pseudo things floating around. And the other one is a combination drugs that I want to see if we can get tested out that block the what's called glycolysis in tumor cells, because tumor cells don't work like a normal cell that works through glucose oxidation with oxygen. On the contrary, they're low in oxygen. This is why Warburg got his Nobel Prize. And we take advantage of this with a lot of our patients by using dichloroacetate, because that will reoxygenate those tissues. So also hyperbaric helps there too, and so on and so forth. Hyperthermia is good too, because the tumors are sensitive to heat.
Okay. And then would you recommend a whole body hyperthermia, or could it be local?
Be local. It could be local. Yeah, my colleague, Dr. Scheller, used to use local.
And what about the IPT?
Nope. Doesn't work. And we've seen it that sometimes they get lucky, sometimes they don't get lucky. I know they're doing it in Istanbul, I believe it is. And sometimes they have some successes for a while and sometimes they don't. It's too touch and go as far as I'm concerned. Because of the fact that we've seen situations where it hasn't done anything. We've seen other situations where they got lucky at the first time. But then what happens whenever you're giving a drug that is destroying tumor cells, the other cells that are tumor cells that are not sensitive to this drug then develop resistance, and we have more problems later on. And this is why we try to do the whole tumor, the whole patient, the whole emotional, where you're sleeping, what you're eating, what your stress levels are, all of these details that I used to think were ridiculous because I thought, just get the tumor, right? Get rid of the tumor. It's not that simple and it's not that easy, but we've been very, very fortunate to have tremendous good results and seeing the patients going into remission sometimes just by changing their diet and lifestyle, just by exercise and diet changes. We've seen this in prostate cancer, for example. Amazing.
Well, I did that, but after 7 months, it's still growing and it's near the rectum. So I'm a little anxious.
I would see about THC. They have rectal suppositories for THC that are very, very good. THC is amazing as an anti-cancer drug, but ironically anti-parasitic. So very often when we have an infection or endometrial cancer or colon or ovarian, we find either parasites or sometimes pathogenic bacteria there. I don't know how it gets there. How the devil does a mouth pathogen get into the ovarian cancer cells? I'd really like to know. But this is what we found, and this is what the data shows. And last but not least, the detox for the heavy metals and all of that, because these tumors are just soaking up the bad guys. And if we just destroy them, the bad guys go everywhere. So that's the problem.
Would you recommend the surgery?
Would I recommend it? Not yet. Not yet. If it's necessary, yeah, in the future, but not now. Right now, what I would do is I would go on the diet, the exercise, the THC, and so on, and use those off-label drugs. But I just wouldn't do I wouldn't use the prostaglandin inhibitors. I'd stick to Boswellia serrata. Because and sulforaphane. Sulforaphanes and Boswellia serrata are the best anti-cancer substances I've ever seen.
Want to learn what the leading edge science says about the most proven anti-cancer diet? What about experiencing the joy and power of meditation, emotional freedom, energy medicine yoga, and ancient healing methods? Or how about learning from world-leading doctors and health experts what you can do to protect yourself and your family from chronic disease and live a long and healthy life? Imagine if you could learn directly from cancer conquerors how they beat cancer using holistic diet and lifestyle approaches. And imagine understanding why certain supplements work, others don't, and what to look for when choosing effective supplements for health and vitality. And what if every month you could get your most important health questions answered by world-leading integrative and holistic physicians and health experts? Now, it's all possible inside Healing Life. Join the health revolution today at healinglife.net.